Like many things that have taken a hit during the COVID-19 pandemic, organ donations have seen a dramatic drop, particularly in communities of color. But those patients waiting for their miracles are still in need. Dr. Harry Wilkins is the president and CEO of Gift of Hope Organ and Tissue Donor Network and the first African American in the organization's 34-year history. Welcome, Dr. Wilkins. How are you?
I'm doing well, thank you. How are you?
Good, good, good. Traditionally, African Americans are very hesitant to be organ donors. As the first African American CEO of this organization, how has that helped you to maybe persist people to donate more?
Well, I'm not sure that it has helped me, but I do understand reluctance. There's, in our community, sometimes there are conspiracy theorists. They tend to abound. But I don't know if that's helped me, but I think one of the things that I have done as an African-American physician, as an African-American person, is try to dispel those myths and just try to talk about the benefits of organ donation. And I think that's what's been helpful, is to at least start the conversation to dispel those myths.
And right now, during this pandemic, organ donation is more important than ever, isn't it?
It really is. It's very interesting. As soon as the pandemic hit, organ donation across the country went way, way down. And as organ procurement organizations such as Gift of Hope really sort of adjusted to the changes, it's actually been seeing an uptick. We've been seeing records across the country.
Really?
So that's been good because the need is greater than ever. There's over 100,000 people on the waiting list for an available organ.
What do you attribute that to, the uptick?
A couple of different things, I think, is number one, I think organ procurement organizations have always had to adjust to difficult circumstances. When you think about it, when the loss of a loved one is the worst time that a family encounters. And that's when the people that work at organ procurement organizations, such as Gift of Hope, meet these families. And so we're very, very good at meeting those families' needs. When we adjusted to the different circumstances, there were times when one of the things that happened was when your loved one was in the hospital, you couldn't go to the hospital, you couldn't visit them. And when they died alone. And so we filled that gap. And I think that's when the organ donation came back up.
What is the risk of getting COVID-19 from an organ?
So since the pandemic has hit, there have been 0 transmissions of COVID from an organ donor to an organ recipient. I think this is from a number of things. Number one, because of organ donation, we go through such rigorous testing. We don't test just for COVID-19, we test for any transmissible disease. And we pivoted very quickly to test every single organ donor for COVID-19. So I think it's very, very low.
What has been your biggest challenge at Gift of Hope this year?
Well, I'm just starting at Gift of Hope, so I'm actually just starting this month.
Oh,
and so the biggest challenge, thank you very much. The biggest challenge actually has been just the transition. It's a very large organization. Most people may not know it's one of the largest organ procurement organizations in the country, of which there are 58. We cover the entire state of Illinois and Northwest Indiana. So that's about a population of 11 million people. It encompasses 9 transplant centers, 180 hospitals, and there's over 300 employees. And so just getting my hands around that organization is probably the biggest challenge, but also gets excitement too. As you know, I'm a Chicago native, and so coming back home to Chicago is a great opportunity.
It's always good to come home. You touched a little bit about it in the beginning of the interview about the conspiracy theorists and things, the reason why people of color are a little bit more hesitant. Can we talk a little bit more about that and try to dispel some of those rumors or those myths?
Sure. The biggest one that I hear amongst African-American populations, and basically any population who's weary or leery of system, so to speak, is that, well, if I'm an organ donor, they won't try as hard to save me if I come into the emergency department. Well, one of the things I will tell you is that for 36 years, I've been a trauma surgeon and critical care physician. And in those 36 years, I've met a lot of patients who went on to become organ donors. I will tell you, though, at the time that I'm taking care of the patient, I have no idea if they're an organ donor or not. In fact, I have no idea who they are most times I meet these individuals. My main and primary concern, and I will say this for all of my colleagues, is making sure that that patient does well. First and foremost, we want the patients to get better, because the only thing that's better than an organ that's been transplanted into you is a well-functioning organ that is your own. So if someone comes into the emergency room and they leave healthy and well, that's our primary goal. And I think that that's kind of a myth that the doctors just want to get the organs. The truth of the matter is I don't know who the recipient is, but the patient is right there in front of me, and that's who I want to help. So that's the number one myth that I would like to dispel.
Dr. Harry Wilkins, thank you so much, and congratulations on your new position at Gift of Hope. There is more information at giftofhope.org.